Good afternoon, everyone. This is Saro, our Arcadian clinical pharmacist. So, Tylenol and pregnancy. Today, Tylenol and its relationship with pregnancy was on the news, discussed and elaborated on. So, I just want to comment on the few information that you may find it helpful when it comes to using Tylenol or acetaminophen during pregnancy. So, today, White House administration officials announced a major progress in understanding the root cause of autism. It was suggested that acetaminophen used in pregnant women, especially late in the pregnancy, may cause long-term neurological effects in the children. For decades now, acetaminophen or Tylenol has been the most recommended pain reliever for pregnant women. Some previous studies have questioned its relationship with autism, but there has been not been any major study showing that. So, U.S. Health and Human Health and Services Secretary has made findings possible that a possible cause of autism is a priority of research, including one in May 2025, launching a $50 million investment or funding for research. Other factors such as underlying illnesses or genetic predisposition could also play a role in development of autism, such as history in the family. So does acetaminophen use during pregnancy cause autism? So multiple observational studies conducted across different population have shown association between frequent and long-term use of acetaminophen in pregnancy and some negative effects on a child's neurodevelopment. However, not all of these studies have a specific relationship to the autism. So we also need to be mindful about limiting potential harm and risks to the patients. In this case, frequent and prolonged use of acetaminophen or Tylenol during pregnancy might potentially be a risk. That said, untreated maternal fever or pain certainly poses a known risk to pregnancy and child development. Thus, it's recommended that pregnant women definitely consult their healthcare provider um, when it comes to relieving their pain, if necessary. Autism is a highly complex disorder, as some of you may know. A 2015 study found that the prevalence of the autism in Swedish children was in 1 in 100, with a higher incidence in boys and compared to girls. Another study in 2019 also reported slight increase in the diagnosis of prevalence of autism in 1 in 80 individuals. A nationwide cohort study with sibling-controlled analysis include a population-based sample of 2,480,000 children born in 1995 to 2019 in Sweden, with follow-up through December 31st, 2021. Acetaminophen use during pregnancy was not associated in this study with children's risk of autism, ADHD, or intellectual disability in siblings controlled analysis. This suggests that the association observed in other models may have been attributed to familiar confronting. So again, and this is a just an update and information about Tylenol and pregnancy that came up in the news today. A discussion if Tylenol acetaminophen is safe during pregnancy or causes autism. The studies and new studies coming up and being funded to look into Tylenol or acetaminophen relationship when it comes to autism. So there are studies out there showing some information about Tylenol acetaminophen use and possible cause of autism. But again, there are multiple studies out there with multiple different results, some bigger than the others. But again, there is more to come, especially when it comes to finding out how much of use of Tylenol acetaminophen is safe during pregnancy or it's not, and its relationship to autism. Hope you enjoyed this video. As always, stay safe and take your medications.